soon. Okay, okay, great, we're on. Great. Well, thank you very much for coming to this course of the basics of vitreoretinal technology. So as retinal surgeons, we're all used to, during our residencies, learning an awful lot about vitreoretinal disease. And generally, meetings are heavily biased towards what we see, what we treat, what we see, which is maybe quite right. But of course, the reality is we actually spend, vitreoretinal surgeons are notorious for this idea of having a work-life balance. In reality, it's work is that, and life is that as well. So, we have this, we basically spend a lot of time with our machinery doing our job. And there's a number of technological advances. This is Alcon's slide, which have come over time. The other companies could show similar slides. And sometimes it's quite difficult to keep up with what the technology advances actually mean if you don't understand the basics at the beginning. So this course is basically to recap and review those basics and theory underlying our everyday surgical tools to be able to enhance the settings and enhance their utility in everyday practice and understand why we use what we do and why the companies have made the advancements they have done. And there's a number of key considerations during vitrectomy, which we'll cover in the course. So which vitrectomy cutter is best and why? Which pumps should I use for my machine? How should I control them with the foot pedal? How should I control intraocular pressure? What sort of illumination is best? What sort of forceps should I be using and why? How are they different? And so, because all those things affect the outcome and they vary according to every individual situation we do during surgery. So we've got an amazing panel, and I'm very grateful for all the speakers for coming. Covering all those aspects. So without further ado, I'll ask Tommaso Rossi from Italy to come and give the first talk on vitrectomy cutter technology. Thank you, Tommaso.
Thank you, David. It is a pleasure and an honor for me to be here today. We'll be talking a little bit about the functioning of vitreous cutters. If I have the images. I'm a consultant for